Guys, welcome back to the channel. So last class we have started with herpes zoster virus. We have seen about some of the features and clinical presentation of herpes zoster virus. We'll be continuing this today. Okay, let's start. So if it involves a trigeminal nerve distribution plus one another cranial nerve, most commonly the facial nerve, producing a facial paralysis. The condition is termed as Ramsay-Hunt syndrome. So, along with trigeminal nerve distribution, if it involves one of the more cranial nerve, then most commonly it involves the facial nerve. It produces facial paralysis, the condition known as Ramsay-Hunt syndrome. And the lesion characteristically begin in the external ear and mimic a painful otitis externa. Okay, it begins in the external ear and mimics otitis externa. Okay. The syndrome may also produce symptoms related to other cranial nerve involvement. Symptoms like vertigo and deafness related to vestibular cochlear nerve, that is cranial nerve 8. Then symptoms like dysphagia, uvular deviation to the unaffected side related to the vagus nerve, that is cranial nerve 10, and even paralysis of the ipsilateral tongue related to the hypoglossal nerve, that is cranial nerve 12. So it may involves the various cranial nerve also. Okay, now coming to the differential diagnosis, it is a diagnosis of clinical recognition in the oral cavity and in its early stages. The presentation of burning pain may confuse with recurrent herpes simplex lesion or a focal atrophic candidiasis. So, any herpes zoster virus is the condition which is diagnosed on the basis of clinical appearance. So differential diagnosis is not as such prominent, but when it is in its early stage and the oral presentation may mimic recurrent herpes simplex and focal atrophic candidiasis. Now coming to the diagnostic workup, immunoperoxidase testing using anti-VSV, that is varicella zoster virus antibodies, to identify varicella zoster virus in it. Okay, but mainly it is a clinical diagnosis. Now coming to the histopath part, with the reactivation of the virus in the ganglion become edematous and there is infiltration of lymphocyte, plasma cell and macrophages. Focal area of necrosis, intranuclear inclusion may be found in neurons. Okay. Now, following the attack, the ganglion returns to the normal except for loss of neurons secondary to fibrous scarring. May also cause lymphadenitis. Now coming to the treatment part, it is a painful and debilitating disease that is destructive of tissue. Skin necrosis with severe scar formation often occurs, as does pain after the lesion have healed, a condition called postherpetic neuralgia. तो जब lesion heal हो जाता है, then there is a pain which is known as postherpetic neuralgia. So, and it becomes secondary infected by bacteria. High incidence of encephalitis complication if the ophthalmic division is involved. So the treatment should begin as soon as possible, reducing the disease course, मतलब shortening the disease course and reducing the above concern. मतलब ये जो भी है necrosis, scar formation, postherpetic neuralgia, encephalitis, ये जो चीज़ भी है, according to that will the treatment follow. The first drug is acyclovir 800 mg 5 times daily. Then is famiciclovir 500 mg 3 times daily, or instead of that we can give valacyclovir 1 gram 3 times daily for 10 days. Along with this we give carbamazepine 200 mg 3 or 4 times daily to reduce neuralgic pain, and in addition prednisone to 20 mg 3 times daily is given for 7 days, then 10 mg twice daily for 7 days and 5 mg once daily in the tapering dose for 14 days to reduce inflammation based tissue loss. So mostly antiviral drug carbamazepine and prednisolone are the drugs given in the herpes zoster infection. Now, if oral lesion predominant, intravenous fluid management or nasogastric feeding may be needed क्योंकि the patient is unable to swallow or eat. A herpes zoster vaccine is now available as a single dose preventative. That's all about herpes zoster infection, their treatment and clinical score. We'll be starting next infection in the next class. Till then, like, share, subscribe, and comment. Bye.